Behind the closed doors of Russian rehabilitation centers lies a world that resembles a prison more than a place of treatment and the regaining of dignity. Most of them are located in old hospitals or post-Soviet barracks, where cold drafts sweep through the corridors and plaster falls from the walls like the skin of an old snake. In winter, the temperature in the rooms can drop to just a few degrees, and the only source of warmth is often an old blanket full of holes. Privacy does not exist. Several men in one room, bunk beds, a shared bucket for laundry, and one toilet for over a dozen people. The bathroom is a place of humiliation. From the tap drips water the color of rust, which no one wants to touch. Bed linen is changed once a month, sometimes not at all. The sheets are soaked with sweat, blood, and the smell of cheap spirits from the past. The food resembles Soviet-era rations: cabbage soup, tasteless groats, and a slice of bread, sometimes moldy, sometimes simply hard as stone. Conversations with other patients may be punished. Silence is enforced, and every whisper is a potential report that can end with a beating from the staff. Contact with the outside world is reduced to a minimum. No calls, no letters, not even thoughts of leaving without the therapist's permission. Letters are censored, and anyone who tries to share too much information may be summoned for a disciplinary conversation with a former officer. Sometimes a family registers the alcoholic without his consent. He ends up here by court order, often unaware that he will not leave this place for several months. Some are brought in handcuffs, and documents are signed under duress, with tremors from the last bottle and vomit on the cold concrete. Instead of conversation and therapy, one receives a pharmaceutical cocktail that does not soothe, but turns the body into a vegetable and the soul into a numbed shell. Sleeping pills, sedatives, antipsychotics, given without asking, without explanation, without any diagnosis. Many patients do not know what has been injected into them. They can sleep for 3 days, then wake up with no memory and drool on their chin. There are no talks with a psychologist, no group therapy, no one speaks of feelings. The main thing is to survive another day without going insane. Therapy is a fiction. No one wants to talk about traumas because every conversation is a risk that someone will call you weak and you will spill like a child. In the Western understanding of treatment, there is nothing here. No exit plan, no support, no path to sobriety, only a loop of pain. After leaving, no one helps. You return to where you drank, to the same people, the same debts, and the same stinking mattress. And the worst part is that some end up here a second, third, even fifth time, because they know no other way, and this place, though horrific, offers at least an illusion. Over everything, watch men in uniforms, former soldiers or officers who never forgot how discipline is enforced. Drill is mandatory: waking at 6, lining up, reporting, and bed inspections like in the Army with shouting if something is wrong. Disobedience brings punishment: kneeling on the floor, isolation, or in the worst case a quick and brutal beating without witnesses. Patients are afraid to speak, their eyes empty, their voices quiet, as if each feared that words would echo back in the form of fists. Some whisper about comrades who could not endure. One slit his wrists, another swallowed an entire blister pack, a third escaped through the window. Some say they feared the doctors more than hunger, and each day on the ward felt like a survival game in a world without rules or mercy. A patient from St. Petersburg recalls being kept in a basement, with bars on the window and a ban on speaking. There was no therapy, no words of encouragement. There was silence, pills, and fear that pierced the back of the neck like a knife every time the door creaked. One former patient said he came out worse than he went in. Immediately after leaving, he bought vodka and drank the entire bottle at a bus stop. These are not isolated stories. They are the everyday reality of hundreds of people who, with hope for rescue, end up in places where dignity is lost on the very first day. Beyond the state facilities, there exists an entire underground market of private treatment centers, which have nothing to do with therapy apart from the sign above the door. They are often locked houses with bars on the windows, where doors are shut from the outside and the patient is treated like an unwanted animal with a problem. They are run by people without education, former security guards, self-proclaimed therapists, or former alcoholics who believed they could cure others. It has happened that patients died from exhaustion, from poorly chosen medications, or simply from a lack of medical care in a critical moment. Families often pay tens of thousands of rubles, believing in false promises, because a desperate parent clings to any hope, even a criminal one. The price of treatment in private centers ranges from 50 to 250,000 rubles for 2 weeks, with no receipts and no oversight. In return, the patient gets a dirty bed, drugs of unknown origin, and a promise that he will leave sober, though no one asks in what mental state. In state facilities, treatment is theoretically free, but there is a wait. 2, even 3 months if one has no connections. For a drinker, this is an eternity, because every hour without help is a greater risk that he will not live to even knock on the clinic's door. The problem is that for many doctors, treatment ends with detox. Once toxins leave the body, the patient is considered cured. There is no work on the addiction, no tools for living. There is only a cleansed body and an empty head full of demons waiting to return. Most go back to drinking. Statistics say that over 80% of alcoholics in Russia reach for the bottle again within half a year. And although the numbers are alarming, the system does not see it, because it is easier to pretend the problem does not exist than to admit that the method of treatment is pure fiction. As a result, Russian rehabs produce more coffins than people capable of living without alcohol, and every story ends in pain and silence. Russia is among the countries with the highest number of deaths caused by alcohol. This is not statistics, this is daily life, devouring entire families from the inside. Rehabs do not stop this plague. They are like a bandage on broken bones, like a wall of sand against an avalanche that swallows city after city. It is a system that masks tragedy. It gives the appearance of action, but in reality serves only one purpose: to make death look more orderly. Some say they prefer to drink rather than return to rehab, because humanity disappears there faster than alcohol robs the mind.